Hello and welcome to Wellbeing. I'm Graham Wilson. Today we're going to look at physical activity and some programs that our guest is involved with that supports young people in particular. Dr. Alyce Barnes is a postdoctoral researcher at the University of Newcastle, and she focuses on enhancing youth physical activity and promoting gender equality. She leads initiatives like Physical Activity for Everyone, collaborating with schools and communities to embed sustainable health practices. Her work emphasises empowering girls and fostering inclusive environments. Alyce, thanks for joining us today.
Thanks for having me, Graham.
Can you tell us a bit about your background and what led you to focus on physical activity research?
Sure can. So originally, when I went to university straight from high school, I was very eager to become a PE teacher because I really enjoyed the benefits of playing sport growing up. I was very involved in multiple sporting clubs, and I could see how much of a positive impact my PE teachers had on me when I was at high school. And I really wanted to pursue a career where I could educate and coach students and also be surrounded by other people who had similar values around keeping kids active and having that positive impact on them.
You initially planned to become a personal development, health and physical education teacher?
I did, yes. So I studied at the University of Newcastle, so I did my undergraduate degree there. And during that course, you have opportunities to do practical application out in the schools. And so I really enjoyed that part of it. But when I finished my degree, I still felt like I wanted to do something more. So I graduated from PE teaching and I got some excellent work out in the field. But I also enrolled in a Masters of Public Health because I really loved looking at research and was really keen to explore that part of what else I could add to my, bag of tricks and my skill set. So I ended up having an amazing job where I taught in a primary school as a specialist primary PE teacher. So that's not the usual practice. Often as a PE teacher, you would go to a secondary school, so year 7 through to year 12. But I was really grateful for this opportunity in a primary school. So I taught kindergarten right through to year 6, their personal health and development, so the theory side, as well as practical, and then all the sports and coordinated all the carnivals, like the swimming carnival, the athletics carnival, cross country, and fun days like that. So I kind of balanced both the teaching and then I dipped my hand into doing my PhD, which I suppose the teaching and seeing what it was like out in the field, how much there's a disparity between boys and girls and their physical activity levels and their skill, confidence and competence. And so that's why I then sort of stepped towards doing my PhD. And I can tell you a little bit more about that if you like.
Yeah, please do. You noticed some variation in the confidence in students.
Definitely. So from the research, we also know from systematic reviews and everything out in the field that there is a big difference between boys and girls' physical activity levels, and that girls drop out of sport at a rate much higher than boys. And this is a trajectory that it continues throughout the life cycle towards, women getting older. And so it's really important to look at what are the barriers around girls' physical activity and what's stopping them from actually having those same skill set and having the initiative to be involved from a young age at school and carry those skills through for lifelong physical activity. So seeing that definitely fostered my passion to create a program which was called Mothers and Daughters Exercising for Life. And what I did there was have an after-school program where mothers and their daughters would come along and participate in an 8-week program. Once a week they'd come into the university and they would participate in a little theory session where we learn about the importance of physical activity and why we do it and how health enhancing it is. And then they would do an hour together of co-physical activity. So that looked like things with fitness, sport skills, integrating fundamental movement skills, which is really key, especially for the primary school kids and the girls to have a sense of a safe, supportive environment to practice those skills like kicking, catching, striking, throwing. And then we did fitness, we did a little bit of resistance. We did boxing, and at the end we finished off with an amazing race. So there was a lot of teamwork involved by the mothers and the daughters. They also had a home program to complete together. So essentially it was like a little bit of extra homework to do. They could involve the rest of their family as well, but just to keep up some of the skills that they were learning in the program.
Why is it so important to involve a parent like that, mothers and daughters?
Yeah, well, what we know is that role modelling is so important. And of course, every dyad is important and influential, so the dads and the mothers, and even further on, other people that are involved in children's lives, such as coaches, are really key to, influencing children, both girls and boys, in having a positive association with being active and practicing and learning resilience through sports. So with mothers and daughters, what we found in my study is that the mothers who actively engaged in physical activity served as a positive role model, and they significantly influenced their daughters' physical activity levels. If you are a parent and you are role modelling positive physical activity to your children, there is a positive effect on the children's physical activity levels. So it's almost like a monkey see, monkey do style.
That's how we learn, isn't it? By observing others often.
Yes. And also in the study, we found that a mother's sedentary habits, so that means sitting time, not being active, and also, I suppose, using prolonged screen time, was associated in an increased sedentary behaviour in the daughters. So as we sort of explained, the more active mothers were, the more active the daughters were, the more sedentary the mothers were, the more sedentary the daughters were. So that really highlights the importance of mothers leading by example and having an active lifestyle.
We're assuming here that physical activity is good for you. I mean, it's a given, isn't it? We know this. But why is physical activity such a powerful tool for public health?
Yes, well, it's extremely important. So we know that it is affecting the global burden of disease. So the World Health Organization states that the most chronic diseases are cancers, diabetes, chronic respiratory diseases, and cardiovascular disease. But globally, these chronic diseases are responsible for 70% of illnesses and deaths annually. And so what we know is that physical inactivity, so not being physically active, contributes significantly towards those diseases. What we also know that if you are physically active, the benefits are so imperative to your overall health. So benefits of being active, this is for children all the way through to adolescents and adults. You have better health outcomes overall. You have reduced stress. You have improved cognitive function, social connectedness. You have better sleep quality. You reduce those risks of those chronic diseases that I mentioned earlier. You have an enhanced self-esteem, and there's positive benefits around academic achievement in kids. So basically, the rule of thumb is there's a dose response for relationship between physical activity and your health status. So being more physically active creates a better sense of your overall well-being and how healthy you can be. And what we also know is that there are guidelines out there that help people understand, well, what should I be doing? Why, like, if this is really important, well, what's the magic number? So there's physical activity guidelines that are set out for children and adults. But we're looking about children in particular. It's recommended that children and young people do at least 60 minutes each day of moderate to vigorous physical activity. So that's the kind of huff and puff, make your heart beat faster kind of activity. And then at least 3 days per week, children and young people should incorporate the vigorous activities and activities that strengthen muscle and bone within that 60 minutes. So they think those are things like running or climbing, doing body weight exercises. So that's why I'm very passionate about it, because we know how important it is and how it's a very simple way to reduce so many negative associations with our health. But we still have a problem with kids not meeting the recommended levels of physical activity. So that's why I'm very passionate about it.
Can you tell us about the barriers that you've seen that cause girls in particular not to participate in physical activity?
Yeah, girls are less active than boys at every age and stage. And so from the research and the evidence, we know that girls are less physically active, and there's a few barriers that have been identified in the literature. So one of them is the fear of being judged. So girls may have a fear of negative evaluation from others based on their physical ability, their appearance, or their choices of activity. Another barrier is the influence and support. So whether there's encouragement and support from family, peers, or mentors can significantly impact a girl's decision to be physically active. There's gender bias and stereotypes that we can see in the media, but even still in schools, that can create barriers that discourage girls from engaging in sports by reinforcing societal norms that label activities such as, that's a boy's sport, that's a girl's sport. And we want to really pull the narrative away from that because that's so negative and it's not a thing. Sports are for everyone. There's accessibility and costs. There's limited access to safe and affordable facilities and equipment or programs, particularly from girls in low income or rural areas. Another barrier is yes, there's lack of time, there's busy schedules or competing priorities, or also lack of motivation can prevent girls from making physical activity a priority in their lives. We talked about the skills before and the difference between the boys and the girls around fundamental movement skills and their sports confidence, but their self-doubt about their ability to be confident and have a confidence to willingly get up at recess or lunch and go and kick the soccer ball around or initiate a game is one of the barriers. We've got body image, so concerns around, perceptions around body weight and attractiveness, and that can also deter girls from participating in physical activities. Another one is practical considerations around their clothing type, which is something that our team at Population Health and the university have looked at, where uniforms at school can be physical activity enabling uniforms, or they can actually stop and impact the girls in a negative way by not having an activity enabling uniform that allows them to move and participate in those physical activities. And one of the final barriers that is definitely known, and I touched on it earlier, is that there can be a lack of female role models. We know how important they are to showcase diverse pathways in sport, and they're really crucial for inspiring girls to engage in physical activity. That was a very long answer. Sorry, Graham.
That's great, though. Do you think there are some systemic barriers that still exist in youth sport?
I do. And we see this even in this day. We've definitely made leaps and bounds with having more female role models and more media coverage, more teams out there. If we look at the Matildas effect and how incredible they are for creating more participation in the grassroots of sports and physical activity. But I definitely feel that, it's really key that we have advocates who are both male and female to change the narrative around sports for women and girls and having equal opportunity and having that equity piece there. So no matter what background, confidence level or ability, it's really important that girls have access to those physical activities so that it feels fun, safe, and rewarding for them. So we need to still have this piece on prioritising the girls' needs. We need to listen to what they need and what they want. What are their voices and their experiences sharing with us? And then having a focus on well-being is really key, because not every girl is going to be an elite athlete or highly competitive. For those girls who are in that area, they often can pursue that path and they've got less barriers in their way. But for the average girl, we don't want them thinking, well, I'm not good enough, I didn't make that team, and now I don't want to join because I don't have that confidence. We really need to create more programs and awareness, even from the core, from schools, to have them, feeling involved and included and having those opportunities there.
On Wellbeing Today, my guest is Dr. Alyce Barnes, Postdoctoral Research Fellow, the College of Health, Medicine and Wellbeing in the School of Medicine and Public Health at the University of Newcastle. Alyce, physical activity for everyone, what does that program do?
Physical activity for everyone is also shortened to PA for everyone. It's an evidence-based program run in secondary schools, and it looks at enhancing student physical activity. So it's not just girls, it's boys and girls, adolescents from year 7 through to year 12. And our team are working with high schools from the Hunter New England Local Health District and working with a school champion. And often those school champions are the head PE teachers or someone in the PE faculty that is taking leadership of being the champion within their school to implement the program. So it's been found, trialled and tested, and it's one of the first internationally programs to demonstrate improvements in adolescent physical activity levels and weight-related outcomes, particularly among students in disadvantaged communities. So the program now, it's got 7 practices, and those practices are embedded and supported through health promotion officers working with the PE teachers and the school champions at each of the schools. And they look at ways to have a quality PE lesson. So how can the lessons be upscaled to be aligned with the evidence and have high engagement from the students and making it easy with lesson plans and resources for these teachers. It's looking at creating a goal for students to have personal physical activity plans and making them accountable for what they're doing and setting goals all related to SMART goals. There's an enhanced sport program, which is known as RT for Teens, and that is a resistance training program that's embedded over a term for a whole year group, or it may be offered as a sport. Another one of the practices which has had really great engagement are recess and lunchtime activities. And if you think about it, kids are at school for such a vast amount of their adolescence and their primary school ages. So it's a great way to tap into opportunity and time for them to be active. So the teachers are given resources and ideas to create engagement in recess and lunchtime activities. And amongst that, there is a push for the priority populations, including girls, and at least 1 out of 3 days a week needs to have a safe, supportive environment for girls to participate at lunchtime, and that may look like this. It could have girls-only resistance training in the hall on a Wednesday. There's a female PE teacher that goes and leads it. The doors are closed, and the girls are able to go in there and have less judgment and worry and fear. They're in that environment where they're with their peers and they're trying something new, maybe for the first time. Maybe they're just doing it because they want to enhance what they're already doing outside of school. But that's a really key practice. We've also got little connections with parents and informing them about the importance and what the program does, and links with the community, so seeing how the program can give girls and boys opportunities to engage outside of school as well. So that program is currently running, and it's being implemented, as I said, across the Hunter New England schools. But the next part of the program is we are looking at how we can sustain this program. So in sustainability research, I'm not talking about sustainable foods, I'm talking about how can a program stay and continue for the long term, because it's all well and good for a program to sort of be embedded and then, we don't have any support anymore, so let's just drop the ball and we'll go back to our old ways. We need to have this as an easy, light touch program for teachers just to continue rolling through their planning and their future planning, so that we can see a better impact on the kids and adolescents' physical activity levels. So that's the next part of the research, and what we're currently working on is looking at the sustainment of these programs. So that's pretty new and exciting, because it's the first international program in a secondary school to be focusing on that part of the research.
Getting it into a school, do you approach the school and say, we've got this program, it's full of ideas and interventions, initiatives, can we bring it into your school?
Yes, so there's different ways to recruit schools. Sometimes we go through multiple avenues, so it's really important to engage the executives. So that might look like the principal, the deputy, and the head teachers. So we'll send out recruitment flyers and explain to them, like, this is our evidence-based program. It's been trialled and tested. This is what we've found, and we are offering this to you. So there's no cost involved. This is something that you can adopt, and we're here to support you as part of the health service. And then we also, we'll go through social media as well as like phoning schools to recruit them, to get them in. And then other times there is also the word of mouth and how other schools are doing great things with the PA for Everyone program. And so that's how we would sort of advertise the program. But we needed, for this sustainment piece, for us to be able to follow these schools over a longer term, we need them to be implementing the program. So that's what they're currently doing and have been doing for almost 3 terms now.
What kind of results have you seen from the program?
So initially in the program, there were really positive results around the children's physical activity levels. So there was a significant improvement over how many minutes the adolescents were participating in moderate to vigorous physical activity. And so that's really key, knowing that if this program is embedded and if these practices, we only needed the schools to embed 4 out of the 7 practices for a significant change to be found. So, we know teachers are extremely under the pump. There is a lot of pressure. There's not a lot of extra time in the day to say, here, put this program in. But the beauty of PA for Everyone is that it is a program that doesn't require too much for the teacher to take on board as the school champion, because you've got a support officer. And the support officer is almost like the coach and the support person to check in, supply all the resources, and allow a really smooth transition for it just to be embedded. And if there's things that pop up that are challenges, they've got the support officer there to navigate those challenges and work with the schools. And we've also developed a community of practice. So often these schools will come together. We've got, social media groups that they can connect on, but we've got email trails. And we did have originally a workshop where they all came together. And there's something really special about having, a working group of people that are the really important minds and brains behind what they see firsthand in the schools. And we work with them to create strategies around this program and sort of troubleshoot if things are, finding a little bit more challenging in a certain school. Some other schools will say, hey, we've tried this, maybe you could embed this. And so that's sort of how we approach the program and how we can create that really positive community of practice.
Does student feedback play a role in shaping the program?
Yes, definitely, because if you don't have student buy-in, then clearly they're not going to want to do some of the activities. Yeah. So, having that autonomy and getting ideas from them about what they would like to do. And as I mentioned before, like with the girls, resistance training, there's a school at the moment that's doing amazing things. They decided with their resistance training kit that in addition to the program being run for all the students, the boys and girls, at lunchtime they wanted a specific session just for the girls with one of the female PE teachers in one of their newer rooms that the school had been renovated with. And they said, that's what we want to do. We want to go in there and we want to put on our own music, and we would like to do this, circuit-style activity. The teachers in there's a rotation. So hearing that is so gold, because if we have their buy-in and we have their motivation to come along and do something like that, then that's going to be, rewarding overall and hopefully having an impact for the long term on those girls. So that's just one example of hearing what works, and what works in one school might be different to another. So it's really important to take into consideration all of those things.
In order to implement the program, Alyce, you need to supply at least one person to liaise with the school, don't you?
So we have a team, and at the moment we've got 3 support officers that are supporting up to 40 schools. And so that basically they've got a cohort on their list, and so they're checking in with them. And we've also created a portal, which is an online hub with specific login details for the champions and the teachers at the school. So a lot of the resources are accessible at any time. And what we're looking at after this first 12 months of the program being implemented is how can we take a step back to a certain point where there's slightly less involvement from the support officer There's more put onto the portal resource-wise, and we're currently creating those strategies to help address any of the barriers so that we can almost like just holding it as at an arm's distance to allow the schools to continue it without too much involvement. They're more light touch strategies, and so that's what we're going to be testing. So I can't tell you what the answers are yet, but shock me in another 12 months, we'll have a better idea of how that's going. And, you know, where our plans are, we will be doing a mixed method approach to that, meaning that we'll collect data that is via surveys, but we'll also perform interviews with those teachers, the head teachers, the champions, and the executive staff and principals to gain further insights and rich data around, you know, what are the barriers that may still exist, what they liked, and, you know, help us inform future research.
How is it being accepted by the health and physical education teachers in the schools?
Yeah, we've had some fantastic feedback from the schools. Of course, there's going to be, you know, times where some schools are very much pressured with other activities that are going on, but they're still able to reach out and ask for the support, or some of them are, in fact, doing so well. We've got a school at the moment who's successfully implementing 6 out of the 7 practices, and it's not even within 12 months, which is incredible. So often you really need to have that champion buy-in. So that's the PE teacher or a teacher who has said that I will be the contact point and the champion for this program to really, you know, find that motivation and drive it, because you've got the whole resource there. You've got the person that you can ask the questions to with the health promotion officer. That's really successful. And another example or another testimonial we have from a school that was having a lot of problem with students turning up to school and whether there was even buy-in for them to come along. So their attendance levels were low. But since the program had been implemented and they created this sense of community for being a PA for everyone leader, this teacher has been such a key role model where, you know, he even involved the students and got them their own polo shirts with the PA for everyone leader logo on them. And then they're creating a sense of leadership within the recess and lunchtime activities. They've got, you know, an ownership of something, and they've seen an increase in their attendance, and they've also seen less, you know, bullying going on and issues, I think, around the behaviour during those lunchtime breaks, because there's been this program, which is such a testament, and it's really positive to get stories like that fed back to the team.
If you could change just one thing about how we approach physical activity in schools or even in the community at large, what would you change?
That's a great question. If I have to say one thing, I think equity is certainly at the core. And so ideally, we want to see a future where every girl and boy, every man and woman, no matter what background, confidence level or ability, they've all got equal access to physical activity and sporting facilities, and that they feel safe and that they are able to engage in that. So I think that equity and equality piece is so important, because we know that there's not an even playing field, and we're certainly, you know, taking steps towards that. There's some amazing advocates out there, and we're slowly making progress. But in an ideal world, if we could just see it so that it is just not such a disparity, that would be huge, in my opinion.
Wonderful. And we should give people a web address so they can find out more about the Physical Activity for Everyone program.
Sure thing. Yep. So it's aligned with the Good for Kids, Good for Life initiative. So if anyone wants to find out more, if they just type in goodforkids.nsw.gov.au, there is a suite of activities and programs that are displayed on the website. And if you click on high schools, you can see PA for Everyone in there. But it's a great website where there's lots of information around the healthy beginnings, early childhood, primary school, teachers, good for girls, and parents and carers. So it's good for kids, good for life.
Good for kids, good for life. And you spell out the word for, or is it number 4?
You spell it out. Yes, good, F-O-R, kids. Yes.
Okay, good for kids. Alyce, thank you very much for talking to us today. Much appreciated.
It was wonderful to chat. Thanks for your time, Graham.
Thanks a lot. That's Dr. Alyce Barnes, postdoctoral research fellow, College of Health, Medicine and Wellbeing in the School of Medicine and Public Health at the University of Newcastle. I'm Graham Wilson. Thanks for listening, and all of us at Wellbeing wish you well.